Deliverable 6. Welcome and thank you for attending. This presentation is going to discuss a health initiative program to improve the health of low-income adolescents within the community. The prevalence of childhood obesity is highest in urban settings and in minority populations and lower-income households. This stresses the need for a health initiative program. This presentation will discuss why this population is vulnerable, along with a discussion of the health initiative program. We will also look at the data collection efforts as well as the measurements and evaluation of the health initiative program. The population of focus for this health initiative program is low-income adolescents, especially minorities such as Black and Hispanic. According to the CDC, the prevalence of obesity in adolescents was 19.7%, affecting about 14.7 million children in 2020. Adolescents living in households are more likely to experience food insecurities and a lack of consistent access to healthy foods. Poverty increases the risk for developing obesity as it limits how much people can spend on food, which affects nutrient intake. The poverty rate for Winnebago County is 14.3%. However, the Black community, it is 22.8%, and the poverty rate for the Hispanic community is 20%. This leaves these adolescents at a higher risk for health disparities that can lead to obesity. This program aims to create more awareness and provide education and resources for adolescents and families within the community. This leads to the goal of lowering obesity in the adolescents and creating healthier communities. Addressing obesity requires a comprehensive and multi-level approach that combines individual behavior change with environmental and policy changes. This program will utilize specific objectives to make progress in reducing obesity in figures throughout the community in adolescents and improving overall population health. The program will involve well-known figures throughout the community to promote healthy living, such as teachers, coaches, youth group leaders, and others who play an essential role in the community. These individuals will be part of sessions that will meet 3 times a week in locations throughout the community, such as Boys and Girls Club, schools, and local community centers. In these sessions, health education will be provided along with engagement in physical activities and healthy snacks, along with providing families with healthy foods. Recruitment for the program will be done by sending flyers containing information home to children from various elementary schools. Recruitment will also be done by utilizing social media platforms like Facebook, Instagram, Twitter, and LinkedIn to reach possible participants, along with helping to engage with the target population directly. To collect data for this research program, a mixed method approach will be utilized. Both qualitative and quantitative data will be collected. Information from the participants will be gathered through surveys, interviews throughout the program. Open-ended questions along with rating scale questions will be asked. This will be done with both the adolescents and the parent guardians who participate. The purpose is to gain as much information as possible. By combining the strengths of qualitative and quantitative methods, researchers can produce more robust, nuanced, and impactful research outcomes. Mixed methods also offer flexibility, allowing researchers to adapt their approach based on the evolving needs of the study. Researchers can modify their methods, adjust sampling strategies, or incorporate additional data collection techniques as needed, enabling a more responsive and dynamic research process. Formal evaluation methods will be used to gather on the program's effectiveness. Questionnaires will be created and sent home to the parents throughout the program as an ongoing way to monitor health and wellness knowledge. One example that will be used is the Short Assessment of Health Literacy English, which contains 18 test items designed to assess an English-speaking adult's ability to read and understand standard medical terms, along with the Short Assessment of Health Literacy for Spanish. The test can be beneficial to understanding participants' health literacy levels to determine better ways to help adolescents with health literacy. With informed consent, evaluating data such as tracking BMI and measuring other basic health assessments of adolescents involved in the program is another method that will be used to measure the effectiveness of the program. Interviews and focus groups will also be conducted. These qualitative methods involve engaging participants and program staff in guided conversations to gather insights, perceptions, and experiences related to the program. They can help identify strengths, weaknesses, and areas for improvements. These measurements will be taken weekly to determine if the program is impacting the health of the participants and determine if the program is proving to be effective. Low-income adolescents, especially minorities, are at a higher risk for obesity within our community. This health initiative program is aimed to increase knowledge and improve the health and wellness of this vulnerable population. With mixed method collection and in-depth evaluation, determination of the effectiveness of the program can be determined and decided.